All right, so this last presentation is the third in our series of 3 that we've discussed over the past few weeks. So the first one was really like those active steps that you can take, today to kind of get started on preventing or reversing this or improving it if you live with it or you know someone who lives with this condition, diabetes or prediabetes or high blood sugar. The second week was more kind of breaking down like the food component of it. So like what's a carbohydrate? How does that affect your blood sugar? This last one, I really wanted to dive more into like what is diabetes? Because I think a lot of times someone gets this diagnosis thrown at them and they're just like, okay, you have diabetes or prediabetes, let's treat it. And it's just like, whoa, what even does that mean? You know, it's a word we hear a lot, but I don't think everyone necessarily knows what it means, the side effects, that type of stuff. So I wanted to dive into that today, and then we're going to talk a little bit about like sugar and sugary beverages and artificial sweeteners. Okay. So diabetes is actually referred to as a gateway diagnosis. And what that means is that, typically kind of like a gateway drug, right? I'm sure you've heard that term. Typically when you're diagnosed with diabetes, it ends up resulting in multiple other chronic diseases or being associated with them. They kind of all play hand in hand. So 2 out of 3 people with diabetes dies from heart disease or stroke. Currently, 84.1 million Americans have prediabetes and 30.3 million have diabetes, 98% of those being type 2 diabetes, so adult onset based on lifestyle. And then it's projected that 54.9 million will be living with diabetes by 2030. So kind of like the COVID we're dealing with now, it seems like this is, a problem that's not going to go away anytime soon. So it's something that we kind of need to address and learn more about and see what we can do to help ourselves in the process. So 1 in 3 American adults has diabetes and 9 out of 10 don't even know it yet. So you or someone you know most likely is either pre-diabetic, diabetic, or is on that path and doesn't have any idea. So what does pre-diabetes mean? So this basically just is a fancy word for your blood sugar is remaining higher than it should be. So rather than your blood sugar going back to a normal healthy amount following eating a meal, your blood sugar remains high. And the reason why you do not want that is because it causes damage, okay? So when you start off with prediabetes, it's absolutely reversible, and even diabetes is reversible, but as it progresses from prediabetes to diabetes, the damage is a lot more great. So in comparing type 1 and type 2, pretty much everything that I've talked about thus far in the past couple presentations is addressed towards type 2. And the reason being for that is that type 1 diabetes is really an autoimmune condition. You're born with it and you can't really change it, but absolutely can treat it and live with it. Whereas type 2 diabetes is typically diagnosed later on in life, and it is reversible, it is preventable, and it does have roles that play in genetics and all that, but yeah, they're very different. So type 1 diabetes, if you had that by now, you would probably know. Very small chance that you didn't, but it's typically diagnosed when you're a child. So type 2 diabetes is a progressive condition involving changes in 8 different organs in the body, including the pancreas, liver, muscles, and kidneys. A lot of medications are given to treat this, and it often requires insulin in most cases. They both have unknown causes. I read that originally they didn't know what the pancreas even did, back in the early 1900s. All they knew is that when they removed the pancreas, people would quickly die due to high blood sugar. So, that's kind of the beginning of the starts of the diabetes research. And, the beauty of it is that, treatment, it doesn't necessarily mean that you have to avoid or limit your foods. It's just managing them. It's managing what you choose to eat when, okay? And these are like the specific numbers that doctors use to diagnose. So A1C fasting plasma glucose, and OGTT. So A1C is something I talk to people a lot when we work together. You know, some of you might know, like I'll be like, what's your A1C goal for your next doctor's visits? Because I think a lot of those of you who are getting your A1C tested are going at least every 3 months, which is fabulous. That's great. So when you're a normal non-diabetic person, your A1C is going to be below 5.7. And then pre-diabetes is greater than 5.7, and then diabetes is greater than 6.5. So I know a lot of you teeter in that range of 5.7 to 6.5, and that is completely based on lifestyle factors. Obviously, at that point, your doctor is probably giving you metformin or some sort of other medication, potentially even insulin, long-acting insulin or something like that. But you know, that's majorly affected by lifestyle choices. The FPG and the OGTT, the only one that, well, OGTT you're not really going to look at, but the fasting plasma glucose. This is something that you, me, anyone, we could all measure this today. You can get a glucose reader at Rite Aid. You don't need a prescription from your doctor. You can prick your finger, test your blood, and see what your fasting plasma glucose is. So you want to do that before eating or 1 to 2 hours after eating, and you can see what yours is. So if it's below 100, you're normal. Greater than 100, you're pre-diabetes, and then above 126 is diabetes. Okay. So here are some signs and symptoms. And here's the thing, this is a pretty silent disease until it's fully progressed to diabetes. So when you have pre-diabetes, there's gonna be no signs or no symptoms. So we'll look at that a little bit in the next slide, but you know, the symptoms aren't going to onset until you are officially diabetic. So some of those symptoms include increased urination, increased thirst, appetite, weight loss, fatigue, blurry vision, numbness or tingling in the hands or feet, unexplained weight loss, and sores that do not heal. You have these symptoms, that doesn't necessarily mean you have diabetes. Obviously, only a doctor can, you know, diagnose you, but you know, based on those fasting blood plasma glucose numbers, that's an important thing to look at. Risk factors. So these are the risk factors if you're wondering if you're at risk or if you potentially have it or at whatever. Over the age of 45, you've developed gestational diabetes or gave birth to a baby over 9 pounds, sedentary lifestyle, overweight or obese, family history of diabetes, and then certain minorities are more at a higher risk, and if you're pre-diabetes. And you know, the thing is, like some of these factors, 45 or older, no, you can't fix that. Family history, no, you can't change that. But actually over 50% of your risk for diabetes is based on factors that you can improve. And that's things like weight, activity levels, cholesterol, and blood pressure. So this is a little quiz you can take yourself right now. So if you have like a pen and paper, you could do this. I'll give you guys like a minute to do this. How old are you? So fill in your age based on the points. So if you're less than 40, 0 points, more than 40, 40 to 49, 1, 50, 59, 2, etc. Man or woman, sorry guys, you're at a higher risk. Have you ever had gestational diabetes, which is diabetes when a woman is pregnant? Do you have a mother, father, sister, brother with diabetes? And then you can look at that chart, and that's based on your weight, how many points you can see at the bottom there, 1, 2, 3. And then you can add up your score. So if you have a score of 5 or higher, not necessarily diagnosing you, but it's definitely something that you should talk to your doctor about and see, you know, what he says about it, see what can be done or if you are at risk. So this is essentially where the whole diabetes dilemma starts. This little corn on the cob looking guy, this is the pancreas. And this is where insulin is secreted, the fancy little chemical at the center of it all, hormone, I guess I should say, which is what removes sugar from your bloodstream. So In a healthy person with a functioning pancreas and insulin mechanism, you eat your sandwich, your body breaks it down into glucose, your pancreas releases insulin, and your body turns that into energy for your cells so you can go for a run or go for a walk or just wake up in the morning and feel good. But unfortunately, in a diabetic person, you eat that same sandwich, your body breaks it down into glucose or sugar, and either your pancreas does not secrete adequate insulin or your cells are not as susceptible or sensitive to the insulin, so therefore they're not able to accept as much energy into the cells. So you end up with low energy and high blood sugar. I took this slide from my last presentation, but I wanted to touch back on it again just because I think it's important in understanding like I think it's important in understanding that the mechanism of it all. So digested carbohydrates are processed by the liver and stored as glycogen. So that's what your body packages up as real nice so that it can use it later when you're hungry or exercising and you don't have adequate carbohydrates. The excess that is not stored as glycogen in your liver is exported back into your bloodstream, okay? So if you've already had enough sugar today, maybe it's all going to be exported back into your bloodstream. This is when insulin is released. And in a normal, healthy person, it sends the signal to your body cells to remove the glucose from the blood and put it into your muscle and liver cells. In someone who's diabetic, either not enough insulin is secreted or your cells are not accepting it. So the insulin is almost like a key to the door of the cell. And if you don't have adequate insulin or your door just isn't accepting that insulin, the door doesn't open and the blood and the sugar is just floating in your bloodstream. When excess sugar is not able to get into those cells, or your body has reached capacity in those cells, it has a third path to accommodate excess sugar, and that's turning it into triglycerides. And you guys should be familiar with this term, and if you're not, you should be asking your doctor to give you a blood triglyceride test at every blood draw, especially over the age of 45. This is definitely a number that you want to be aware of and watch, because this is excess fat in your blood, and it's one of the main contributors to heart disease and stroke and arteriosclerosis. So triglycerides are mainly from excess carbohydrates, but also just excess calories in general. So, you know, that's just, I think that's an important tidbit to know, because I think a lot of people don't realize that triglycerides are actually associated with your carbohydrates. And this really explains how carbohydrates and diabetes play hand in hand with heart disease. So this is pretty graphic. Close your eyes if it freaks you out. These are the side effects and complications of diabetes. So I think this is really important because I think a lot of diabetics don't know that ulcers are a huge problem that they deal with. When I worked in the hospital setting, I had a lot of diabetics, and I think that's kind of why I've become so like passionate about diabetes, is because it just broke my heart to see them having, you know, they'd have a toe amputated due to an ulcer, and then their whole foot, and then a whole leg below their knee, and then a couple fingers. You know, it was very progressive, because that's what happens when you don't maintain your blood sugar. Someone who's diabetic can live a long and healthy life, absolutely 100%, if they maintain their blood sugar. And so these are the other complications aside from that: heart disease, stroke, diabetic retinopathy, which is essentially going blind from the high blood sugar, diabetic neuropathy, which is kidney disease and eventually leading to dialysis or kidney failure if not improved upon, neuropathy, which is nerve damage, infections, which often lead to sepsis and potentially death, nervous system disease, blockage of peripheral arteries, amputations, and of course pregnancy complications. I think the most common side effect that you see of these is the neuropathy. And if you're diabetic now, you probably have experienced this. You start to get numbness or tingling at first in your feet, but also in the fingers and the extremities. You can't feel your fingers or toes, and that's why they end up with these ulcers or feet injuries, because you could step on something and just not feel it because you have that numbness. So that's why if you are diabetic, check your feet diligently. It is so important, because you could end up with one of these and not even know it. And that's also why they make special shoes for diabetics. So if you've been diagnosed with diabetes, this is what your doctor is gonna talk to you about. You have like a few different routes. So oral meds are usually the first route. If you're pre-diabetic, your doctor is probably gonna recommend metformin or some sort of oral medication. Metformin's the one that I saw used most when I worked in the hospital. So that's like a daily, it's just a pill. Insulin typically isn't prescribed until you are full-blown diabetic. And this is something that is typically injected, or there are pumps. Your home glucose meter, this is something that if you are diagnosed diabetic, you need to be checking your blood sugar before all meals, especially if you are taking insulin. You know, I've talked with people who are diabetic and would inject their insulin before eating a meal. And, you know, my response to that is, well, how do you know that you need that insulin? Because potentially you're going to end up either hypo or hyperglycemic, because that insulin is based on, you know, your meals and your dosages, and exercise too, because exercise uses carbohydrates. It's definitely not simple. It's definitely very complicated. And I think that's why it's hard for a lot of people dealing with this condition. Obviously, last but not least, and my favorite, diet and exercise. So if you have a good doctor, a really good doctor, when they diagnose you as pre-diabetic or diabetic, they're going to say, well, we do have these options. We do have insulin. We do have medications. But the best way you're going to improve this, and the best way you're going to prolong your life and make it better and more comfortable and happier and healthier, is diet and exercise. And you know what, honestly, I actually read, I wrote it in later in one of these slides, but you know, I've actually read that just walking after meals has been found to be as effective as taking metformin, one of these diabetic medications. So you can take metformin, which has negative side effects, which we'll talk about later on, or you can simply go for a walk. I mean, I think that's that's such an easy choice to make. So these are the side effects of insulin and metformin. I think it's important to talk about these because, you know, they don't come without a cost or a risk, okay? So the most common side effects of insulin might be initial weight gain, because, you know, it's kind of turning that key that wasn't turning before, so it's letting the glucose go into the cells. So you're gonna have some initial weight gain, potentially swelling of your arms and legs. Hypo or hyperglycemia, as your doctor is trying to figure out the right regimen for you. Rashes, bumps, or swelling at the injection site. And if you ever have these, absolutely do not continue to inject at the site. Call your doctor, you know, have him take a look at it. Anxiety or depression, a cough when taking inhaled insulin, and the need to increase the dose and complexity of the treatment plan over time. The effects of metformin include heartburn, stomach pain, nausea, vomiting, bloating, gas, diarrhea, constipation, weight loss, headache, and an unpleasant taste in your mouth. Metformin is probably the one that I hear a lot of people going off of because they didn't like it and actually choosing to take the high road and choosing to try exercise and lifestyle change, because it does have a lot of negative health consequences. I've actually heard of it causing balding in some women, and the stomach pain is the one that I hear a lot. Less common side effects of the insulin: fat necrosis, which is a lump that forms from injecting the insulin. Severely low sugar, so anyone who's diabetic knows that when you get low blood sugar, you can go into a coma. I've seen a patient, I think the first time I saw a patient with low blood sugar, it was like really shocking to me. She had severely low blood sugar. We took her sugar, I think she was at like 40 milligrams per deciliter, which like you really don't want to be below 70. And she didn't know her own name. So, you know, imagine someone finds someone with low blood sugar on the street. They don't know their own name. They don't know what's going on. You know, they don't know if you're like on drugs or, you know, you're drunk or like confused. You just have really low blood sugar. And honestly, it kind of exhibits almost as though someone is drunk. You know, you act really goofy, but that's when it's severely low. And if that's the case, if someone's ever low blood sugar around you, you absolutely want to get them some sort of carbohydrate containing foods right away. Low blood potassium, heart failure, and a potential increase in the risk for specific cancers. The less common side effects of metformin, lactic acidosis is it's like 1% of people that take this get it, but it's a very severe condition. So if you ever have if you're taking that pill, I'd suggest you look into lactic acidosis and learn a little bit more about it, because it is kind of like one of the major warnings about taking this pill is that result. And then anemia and hypoglycemia. So what is hyperglycemia? I just explained that a little bit. So, you know, that basically what happens when that happens is that you either have too much or not enough insulin. And this is easy to do because your body's not regulating it anymore. You're adding shots into your body to regulate your blood sugar. A normal person, their body regulates this itself using the pancreas. A diabetic, not the case. So if you add too much, you can quickly become hypoglycemic, not enough hyperglycemic. And these all have signs and symptoms of them in themselves. And I think most diabetics I know do recognize their signs of hypoglycemia pretty early on. And I've actually had people say that they're when they're working on improving their blood sugar, even just because they're used to having such high blood sugar, they might feel hypoglycemic at like 125 milligrams per deciliter. So that's kind of like interesting. So prevention and reversal. I didn't want to put too much about this on this presentation since we already talked about it really in the last two. So I kind of just like sum these up once again. Educate yourself. If you're here right now, you're doing that. Obviously, I hope you watched the last two webinars. If you didn't, I recommend you go on my website, healthyfamous.com, and check them out because I think they have some really good info that would be helpful for you. Find accountability partner. Science says you are 80% more likely to be successful if you have someone who's supporting you in your journey to a healthier lifestyle. If you're out here doing it by yourself, no one to support you, no one lives that same lifestyle as you, yeah, it's gonna be harder. So find someone to support you, whether it be me, your health coach, a friend, a family member, whoever you can find to support you. Even if that's not their lifestyle that they choose to live, it's good to have someone checking in on you. So improving eating habits, finding balance. You know, I kind of wanted to like make this like not like your typical advice, like find balance in your lifestyle. It's not about changing everything. And I think that's what makes it so hard for people and why they tend to want like crash diets and stuff like that. It's not an all or nothing mindset. It's not going to be you can only eat salads for the rest of your life. And that's really the difference between diet and health. And that's why I put this infographic here on this side. Health is your long game, basically. You know, we're not, it's a marathon, not a sprint, you know? So it's your long game. So, you know, it's not about how many pounds can I lose this month or this week. It's really about how can I make my body healthier and function better and more energized in the long term. And that's going to be daily victories, not eat healthy for a month and then never do it again. So that's my 2 cents there. So losing weight gradually. So like I said, you find a diet, you lose 50 pounds in a month, that's great, but probably not sustainable. Drinking water, not drinking adequate water does cause high blood sugar. Sleep, not enough sleep can cause high blood sugar. Increased stress can cause high blood sugar. So these are all important things, and these are just the simple pillars of wellness that I'm sure everyone already knows. So yeah, it's a marathon, it's not a sprint. Watch the other webinars for more info on, you know, this type of stuff and action steps you can take. So this was kind of what I was explaining. You know, I think people think that like eating healthy means literally just vegetables. And so they'll try that for like a week or a month or whatever the case, and then they end up going back to their old way. And it's because that's unsustainable. Having literally no joy in your life, no pizza, that's not a life I want to live. And I understand if you don't want to live that life either, because it's not realistic for you. So eating in moderation, pizza here and there, wine or beer here and there, whatever the case, that's going to be a more realistic lifestyle. And even though some days you might be like, oh, well, I ate pizza today. Well, hey, it's better than eating pizza every day, okay? I saw this quote online and I just had to put it on here because I loved it. Those who do not find time for exercise will have to find time for illness. So, I know we all have a million things going on in our lives. We're all so busy, but at the end of the day, if something's important to you, you will find time to do it. And I literally tell this about to my friends, my girlfriends that are single and dating, they'll be like, this guy doesn't have time to hang out with me. I'm like, if he cared about you, he would want to hang out with you. He would find the time to hang out with you. And, I think it's the same thing for exercise. And, I was actually just watching a new documentary last night. It's called A Good Earth or something like that. It's with Zac Efron. So cute. But it was talking about Sardinia, Italy. It's a blue zone, which is a place where people have the most centenarians, people who live to be over 100. And what they said, why they believe they live longer, in part is because they are active all throughout their day. It's not like me, where I go to the gym for an hour in the morning. They are herding their sheep in fields, and they're moving their wheelbarrows everywhere. And while I realize that's not realistic in probably most of our lifestyles, I'd ask, what are some examples of ways you can add activity throughout your day? Oh, does anyone have any examples? Anyone? Pam? So I would argue, what about oh, I got a chat. If I even know how to read it, that is. Going for a walk at lunch. Thank you, Olivia. Or standing up at a walking desk. Yes, that's a great example. What about, rather than emailing your coworker, go down and have a chat with them. What about going for a walk on your lunch break? Yes, whatever you can do, get down, you're working from home, get down and do 10 push-ups. I don't know. I do not know who Trouble is. I would love to know. Trouble, who are you? So yeah, adding, so it doesn't have to be what, I think generally people think is their idea of exercise, which is, going to the gym, sweating it out, or running. It doesn't have to be that. It could literally be 10 minutes a day of doing something that just gets your heart rate elevated. Oops, wait, I don't think we're there yet. Oh, I guess we are. So, oh, Jen says she has a standing desk and she does squats while she's on the phone. That's great, Jen. Love that. Or jumping jacks, whatever. Or jumping rope. It doesn't have to be fancy. So, how do I get rid of this? Coming in August, we're going to be doing a Rethink Your Drink challenge. So I'm super excited about this. I think it's something everyone can benefit from. And what this basically is going to be is that we're going to try to do 1 month with beverages with no added sugars or sweeteners. I'm going to send out a form to sign up on Monday. But until then, start thinking about it. The American dietary guidelines say on average Americans consume 17 teaspoons of added sugar, which is almost an additional 300 calories. And by the way, if you're looking at your bottle of Coke or whatever, 1 teaspoon is 4 grams of sugar, okay? So So if it's got, you know, like even like your oatmeal, like I see those oatmeal packets, one packet might have 10 plus grams of sugar in it. Well, think about all those teaspoons of sugar that if you were adding that yourself, you probably wouldn't add that much. And I think that's why this picture here is really cool, because look at all the sugar in those drinks. Like, that's crazy to look at it and quantify it in that way. So, figures. Oh, trouble. Joe. So soda and other soft drinks account for around half of a person's added sugar intake, and the average can of soda or fruit punch provides 10 teaspoons of sugar. So you're greatly bypassing your RDA with just one Mountain Dew. Those have like, I think it has like 70 plus grams of sugar in it. So yeah, that's a lot. So that's why I think this challenge will be great, because I think you guys won't even realize, like, that one little change you make in your life, well, first off, not only will you have more stable energy levels and feel better, but also you'll lose weight without even trying, because it's such a source of empty calories. And I thought this was interesting. In one study, healthy 20-year-olds were given just 12-ounce soda serving per day, and an inflammatory marker was doubled in 3 weeks. So sugar, at the end of the day, it's highly inflammatory for your body, and that's why this is the thing. I know it's unrealistic to say never have sugar again, but we can definitely reduce it, especially added sugars. So this is a game. Which of these has the highest amount of sugar? Does anyone know? Let's see. I'd say Coke is a guess. What do you guys think? Oh, she's a Pepsi. Well, actually, oh, sorry, apple juice. Olivia guessed it right. You win, Olivia. So, you know, I think this is interesting to see, because while apple juice is definitely the most nutritious option, yes, you get a cookie, Liv. Apple juice is the most nutritious option, obviously, because it has like real ingredients, but it is still extremely high in sugar. You know, it's condensed sugar. So, you know, I just think that's something to be aware of, because I think people just chug down juice. And I used to do this myself. I used to drink probably like 4 glasses of orange juice a day in high school. I just like didn't think anything of it. But yeah, major source of excess calories and sugar. So what about, well, I guess you guys already know, which one of these you guys think has more sugar? So not surprisingly, the orange juice has more sugar. And, you know, this is the interesting thing. Like, if you were gonna try to eat, you know, the amount of oranges that go into an 8-ounce glass of orange juice, it would be 4 oranges. So you can drink 1 orange and feel satisfied and full from all the fiber in there, or you can have a whole glass of orange juice that's high in sugar, high in carbohydrates, and it's going to leave you with an energy crash. So I say go for the orange if you're craving juice. Yes, juice is nutritious, but I'd rather you eat it from the whole fruit rather than this condensed form. So what about these? Which one of these is healthier, you guys? Does anyone know? So this is kind of a trick question. Oops, I gotta guess. He said diet. Sherry says neither. You win, Sherry. We're going to start talking about artificial sweeteners, but basically, you know, the Diet Coke is 0 calories, 0 carbohydrates, 0 sugar. So for someone who's diabetic and doesn't want to have increased blood sugar, it would be a very small step in the right direction. I say that like cautiously, because I'll explain why, but it comes with a lot of other negative health effects. So here are just some of the health effects of sugar. So, and these are some pretty interesting studies. So I hate to read all these off to you, but I'm going to because they're pretty interesting. So low energy levels. A 2019 study found that 1 hour after sugar consumption, participants felt tired and less alert than a control group. Not surprising, right? You drink a sugary beverage in an hour, you want another one because you're feeling groggy and tired. That's from your blood sugar crash. Low mood. A 2017 study found that higher sugar intake increased rates of depression and mood disorder. Bloating. People with digestive issues are going to experience bloating when they're consuming sugar. Tooth decay. I think I've heard, I forget the word dentists use for Mountain Dew. They call it like cavity rot or something like that because it's terrible for your teeth. And I think a lot of you have probably experienced that. Like, do you ever, I know for me, if I ever drink pop, I'm like, oh, I hate that aftertaste and the way it makes my teeth feel sticky. And that's what this is. The bacteria digest the sugar and create acid as a waste product, which can erode your teeth enamel. And this is also why you need to, if you drink sugary beverages, definitely brush your teeth before bed or it is going to erode your teeth. Acne. So sugar causes skin problems. In a study of university students in China, those who drink sweetened drinks 7 times per week or more were more likely to develop acne. And another study suggested that lowering sugar consumption may decrease insulin-like growth factors, androgens, and sebum, all of which contribute to acne. So you want to be beautiful and have nice skin? Less sugar in your diet. Diabetes and insulin resistance, you guys already know this one. Weight gain and obesity, I'm sure that's not a total shocker, but this is interesting. Sugar can affect the hormones in the body that control a person's weight because the hormone leptin tells the brain a person has had enough to eat. However, in a study, a diet high in sugar may cause leptin resistance. This means that over time, a high sugar diet prevents the brain from knowing when a person has eaten enough. So basically, kind of like the way diabetes works, eating a high sugar diet, slowly you kind of just become immune to it and your body doesn't recognize those same feelings of fullness, so you eat more and more and more. Cardiovascular disease. A large study found that people who got 17 to 21% of their daily calories from added sugar had a 38% higher risk of dying from CVD, just from sugar. High blood pressure, cancer. This is a big one that I think is really a major reason in the functional medicine community why they don't like sugar is because it causes inflammation, oxidative stress, i.e. like cell damage from the inflammation, which causes cancer. And aging skin is the last one. So who wants wrinkles? Not I. And these are just some of the forms of sugar. There's a million different names for it, so you have to read your label. Even just reading your label and it saying like 0 grams of added sugar, I wouldn't even trust that. Like, things are so misleading now more than ever. Read that ingredient list if you're looking for sugar to see if it's added in there. The higher up on a label something is, the more it is. So if the first ingredient on your Coca-Cola is high fructose corn syrup, well, guess what? That drink is probably like 90% high fructose corn syrup. If it's the last ingredient, that means it's the least. So if it's the last ingredient, it might only, there's no rhyme or reason to it, but it might only be like a couple grams. So just so you know, if something has sugar as a first ingredient, might be something you want to consume in moderation. The AHA recommends that women limit their added sugar to 6 teaspoons per day and men to 9. So that's just a good number to keep in mind. 6 teaspoons, 25 grams. And some of those, like Chobani yogurts, I think some of those are like 14 grams in themselves. So all you get is a yogurt a day. It's because those have so much added sugar though. So 25 grams is not crazy when you're eating like, sugar within moderation or foods that don't have added sugar. But if you're eating things that are highly processed, yeah, that is pretty crazy to imagine. So artificial sweeteners, obviously have to touch on these. They're important. The main reason why these are a problem is because they are so much sweeter than table sugar. So we've got table sugar over there in the corner. Equal, 200 times sweeter than sugar. Sweet and Low, 300 times sweeter than sugar. And Splenda, 600 times sweeter than sugar. So what this means is that it reduces your sweet perception. So if you eat something that's naturally sweet, say an orange or a banana, which is, you know, a natural sugar, you're used to eating a 600 times sweeter substance every day, that's not going to taste very sweet to you. It's not going to be as satisfying to you. And I say the same thing to people who drink like sugary beverages. You know, of course water tastes like crap to you because you've been drinking a very sweet substance. Of course it tastes better. And of course when you taste that water, it's going to taste super bland and not as appealing. But with time, as you wean yourself off of that, I promise you it will taste better. It's just a process. And we'll talk about some other options for rather than just water in a minute. So here are some of the health effects of sweeteners. So essentially they have been linked to weight gain. So I know this is crazy because they have 0 calories and all that, but it confuses your body. Your body's really confused because it hits your taste receptors and says sweet. So your body expects to have calories, but there are no calories. So then it sends hunger hormones to tell you to continue to eat. So it's really confusing to your body. There's a lot of research that is, there's a lot of research that still needs to be done with these, is what I want to say. There's a lot of studies that go back and forth on sweeteners, and a lot of them, I'll tell you, are funded by the companies that make these things. So, you know, I'm currently working on my master's degree in public health, and this is something that we study a lot, is that, you know, a company doesn't want their product taken off the shelf. They fund studies to support their initiative. So that's just something to be aware of, and it's major in all nutrition science, not just with these. A lot of stuff, you know, same with GMOs and all that stuff, you'll see companies supporting their own initiatives under fake names. These have been linked also to insulin resistance. So, you know, you think these reduce your risk of diabetes, but that's actually not the case. 21% increased risk for diabetes when consuming 2 artificially sweetened beverages a day. And the last, and I think most important way these affect you is your gut health. I've probably talked about gut health in every single presentation I've done, but the thing is that your gut is like, it's like the root of everything in your body. And this is something that has emerged in recent years in research. You know, you don't think about like your gut as one of your most important organs in your body, but it actually is. It's where 90% of your immune system lives. It's where your mood is affected, or positively or negatively. It affects your digestion, everything. So when you eat these artificial sweeteners, it causes dysbiosis in your digestive tract and affects your cravings and your blood sugar control and your mental health and everything. And anyone with like migraines or anything like that probably already knows that you need to stay away from these. Some people are very negatively affected by these. But I put this disclaimer here at the bottom. Negative effects vary by individual. And here's the thing, and this is the thing with any food substance, chemical, anything, all of our metabolisms are different. So the way one of these might affect me versus you versus someone else, it's completely different for all of us, which is why it's really hard to find reliable research on these things, because it's different for everyone. But here are some, you know, like good swaps for you. So I would definitely say like stay away from, you know, the pink, the blue, the yellow, and processed sugar, all the above. And these are better alternatives. Are they still broken down as sugar in your body? No different than the other ones? Yes, but these are more natural, less processed alternatives. So agave syrup, which is very similar to honey if you've never had it, maple syrup, monk fruit, stevia, and sugar alcohols. What I do say though is that limiting your addition of these. So for example, like I used to add stevia to my coffee. And I truly believe that adding any type of sweetener, allowing your body to get used to having that sweetness, makes you crave more. And that was definitely the case with me. stopped adding it, I got used to the taste and I no longer crave it. And I actually crave very few sweet foods in general because of it, because I'm not used to having sweet. So here are some better beverages swaps. Obviously, you know I'm going to say water, duh. But if you don't like the taste of tap water, I thought this was a cool tip. You can leave it out overnight and the chlorine will evaporate, so it tastes better. So I think some people think it's a little bit bitter, tap water. Obviously, I always say water's free, typically. I guess you do have to pay your water bill, but it's very inexpensive. So definitely get the water, especially if you work at like the CDC or somewhere like that. They provide you guys with free water. But you can flavor your water by infusing it with fruit, cucumbers, herbs. I made fruit infused water at the office the other day, and it was a hit. The other day, by that I mean like a year ago, because we haven't been in the office in 100 years, but it's fine. Swap soda for naturally flavored salsa water, such as Buble or Aquafina. I don't know if you guys have had these yet. The Buble has been becoming very popular. There's another one they sell at Target that's really good too. I forget the name of it. But these are literally like plain seltzer water, like bubbly water, that have natural flavors in them, no added sugar, no added sweeteners, nothing. And they're really good. They're really satisfying. Like, the lime one, for a second, I feel like I'm drinking a Sprite. Like, for a second, it tastes like it, and then you're like, oh, the sweetness doesn't come. But it's actually really satisfying. So if you're someone that's like trying to move off of like soda pop or whatever, highly recommend. Herbal teas, unsweetened tea, green tea, matcha. Teas are a great one. I know one of the girls I work with, she drinks like a mango tea, so it's a little bit sweeter naturally, and she really enjoys that. Coffee is fine, but you know, a lot of people add the sugar or the stevia or whatever to it. I'm not like a huge coffee drinker, but I drink it when I need it. And what I do is I just add almond milk to it, and that kind of cuts the bitterness. I don't know. I personally don't drink coffee for the good taste. I just drink it for the caffeine if I need it. So like if you're trying to wean yourself off of juice, I would say slowly water it down. So put, you know, a splash of water in your juice, and eventually, hopefully it's water with just a splash of juice. That's a good way to wean yourself off. Kombucha is a fermented tea, really good for your digestive system. Highly recommended if you ever see it at the store. It's good stuff. It does have like 2 grams of sugar in it, but that's only because the SCOBY in it, which is like the fermented mushroom, it actually has to thrive on the sugar, so it's fine. You make your own smoothie. Notice I say make your own, because the ones that you get from like Jamba Juice or whatever typically have a lot of added sugar or juices as the base. And then coconut water unsweetened, some of those are sweetened. So if you need a good smoothie recipe, I got you. I make a really good one that doesn't need juice as a base. I don't know why some of these places use juice as a base. It's just unnecessary. So, and then this is last. I'm going to send like a graphic of this out via email, but if you're interested in joining the Rethink Your Drink Challenge, these are going to be like some of the specifications. So 1 month, none of this stuff, and I'll write this out and probably include some more, but any beverages with added sugar. So think pop, sweet tea, fruit punch, Gatorade, like orange drinks, like I don't know, whatever that orange one is, slushies, Kool-Aid, juice box, flavored coffee syrups, or beverages such as frappuccinos, chocolate milk, vitamin water, smoothies, Jamba Juice, Snapple, coconut water, body armor, juicy. So some of those smoothies, the reason why I say that is some of those smoothies, like they're made, you need to look up at the ingredients on their board or like online, because they typically do use juice, or the one place even uses like sorbet ice cream as a base. So I'm like, okay, that's like a milkshake. It's not a smoothie. So yeah, juices, those naked juice things. I don't know if you guys have seen those. It'll be like 1 banana, 1 orange, like 1 apple on the outside. Highly nutritious foods, but think about all the sugar that goes in there and that one condensed little bottle, when you could have the fiber and feelings of fullness from like 5 different fruits and vegetables. It's very different, and it affects your body very differently and your blood sugar very differently. So that's not included. Fresh pressed juice. So here's my 2 cents here. If you do not consume fruits and vegetables in any other way, then I would say 8 ounces daily is fine of fresh pressed juice. But if you do, I would say eat those. So like celery juice is a big trend right now in like the wellness community. And the thing is that you get the same benefits and more fiber from simply eating the stalks of celery. So there's no reason to condense it into the juice. So adding honey into beverages is another source. So that's something to be aware of. Read your labels for like almond milk, oat milk, soy milk. Typically in corporate office, we have 2 almond milks in the lunchroom. There's one that has added sugar and one that does not. And the only way you know which one's which is reading it. So just be aware of that, because I think the one has like 80 calories and maybe 10 grams of sugar per serving. And the other one has, I think it's like 20 or 30 calories and none. So artificial sweeteners are not included on this challenge. So like diet pop, sweetened flavored waters, coffee, tea, and then artificial sweetener powders. So those little powder sticks that they sell at the store, like the Crystal Lights, the Mios. Read your label. If it says aspartame, sucralose, any of those, that's Splenda, stevia, that type of stuff. So we don't want to do that. We're trying to do 1 month sugar-free. So that is all. I hope you guys learned some good stuff, and I hope that some of you join in on this challenge, because I think it's going to be super fun and exciting. So that's my 2 cents. So thank you all for joining. Does anyone have any questions?
When is the Zac Efron show on, or what channel?
Netflix.
Okay.
It's just Google like Zac Efron documentary, and it's all about like environmental, different environmental like causes that he wants to further explore. So I watched the one about Sardinia, Italy yesterday, because he was talking about how you could live a longer life, but there's a ton, and they're actually really interesting. Like they talk about renewable energy and some other good stuff. So yeah,
Okay.
Pretty cool stuff.
Okay, thank you.
Yeah, definitely check it out. All right, guys. Any other questions? No? All right, well, thanks for joining.
Good to
Good
see you.
times.
Stay safe.
Okay, I will. I'll give you, wait. Email me. And Jen, I know I have to email you back. I haven't gotten back to you yet. I've been finishing this little baby up today.
Yeah, you're busy. Take your time. All right, we'll see you later.
Bye.
Bye.